Hey guys, my name is Todd Derry. This is TD's Fat to Fit, your free online strength and conditioning coach in your pocket. I've been dealing with tennis elbow lately. It's been driving me crazy. It's like I can't even squeeze a Coke can off my lateral side right here. Just is debilitating pain. And I've used BPC-157 in the past. So I thought, let's do a video on that. And in doing this little bit of research, I've had a lot of experience with BPC-157. I've coached a lot of people that have used it. So I know a lot about it, but there are so many other peptides out there. And they're not just semaglutide, the GLP-1s that you see on every stupid commercial on Fox News and ABC and NBC and all over the internet. They're just everywhere. Every person seems like at the gym is on semaglutide with the skeleton face. You can see it from a mile away. The peptides, there's a few more, there's a lot more than just GLP-1 agonists, and they have incredible promises, but is it a miracle cure or is it hype? So I'm going to do a series, the vampire series, because that's what they are. They're like making us vampires without drinking blood, of course. You know, they basically make us younger, increase your healing power. They make you stronger. They make you have better stamina and better cognition, improve libido. There's a lot of promising, incredible things that these peptides have to offer. Specifically, this video is going to be about BPC-157. So I asked a few questions about it specifically. When was it discovered? Who discovered it? Is it legal? Does it work? What are the benefits? Is it hype? Is it dangerous or risky? And if so, what are the adverse side effects? But first, as you know, I'm not a doctor. Cops be pulling up like I'm passing out drugs. Nah. I'm a bodybuilder, not a doctor. If you have any questions or concerns, call your doctor or your medical practitioner. With that said, let's get into BPC-157. BPC-157 was discovered in 1993 by a guy named Predrag Citric. I think that's how you pronounce it. He's a medical science researcher in Croatia. It's a pentadecapeptide called body protective compound. It's 15 amino acids long, and it's basically the 157 component of the name is the sequence within the larger protein molecule. So there's a protein molecule, and at the 157th position in this sequence is this body protective compound. That's BPC-157. They've been able to isolate that sequence. These amino acid chains create protein, which signal for many different mechanisms and receptors to be turned on or activated in the gut. This stimulates vascular endothelial growth factor, angiogenesis. Basically, angiogenesis is the production of new capillaries and small vesicles, increases nitric oxide production, increases growth hormone receptivity, stimulates production of tendon fibroblasts, again, basically the introduction and creation of new collagen, endothelium and epithelium maintenance, recruitment of collateral vessels to increase blood flow to the injury area or damaged vessels. It also restores the serotonergic transport system, which can play a major role in the communication between the brain and the gut. So the legal status is interesting. BPC-157 is not currently legal to consume. You can buy it as a research chemical, and this goes for the United States, United Kingdom, Europe, most European countries that I could find, Australia, and it's considered a research chemical and is legal to purchase, but you can't consume it. It is not approved for human consumption or a dietary supplement. So what's the FDA status? FDA status, it cannot be marked or sold as treatment for any disease or health condition. The FDA stated there is no evidence or lack of safety evidence on the compound, which just decided to ban the substance for human consumption. So basically, there's no data, there's not been any human trials, and so because of that, they have a lack of safety data because they've got to protect us. God forbid we hurt ourselves, right? Because smoking and drinking are so good for us. And because of that, they've marked it as research chemical, and you cannot sell it as any type of a consumable product, and we cannot consume it as any type of a consumable product. WADA has banned it, and the USADA has also banned it. So if you're in any competitive sports, don't take it, because if they test you, you'll get banned. Currently being researched in these areas. So this is what most of the research in BPC-157 is going into these areas: healing, digestive health like IBD, colitis, Crohn's, and ulcers, cognitive health, muscle growth, reducing pain for injury and chronic pain, reducing systemic inflammation, increased renal function for end-stage renal disease or kidney failure, restoring liver function for NSAID toxicity, and it's also being studied for mitochondrial function and protection. So what's the function of BPC-157? The role of BPC in gastric juices is very critical. It promotes rapid healing within this extremely acidic environment within the gut and small bowel. The system has been reported to replace every cell within the endothelial lining of the esophagus, gut, and small bowel every 3 days. It's very thin, and it replaces all those cells every 3 days. This function is primarily activated because of the BPC-157 mechanism. It is a healing protein from ulcers and inflammation. It may also play a critical role in signaling between the brain and the gut axis. Anecdotal evidence: incredible reports of chronic injury healing in minimal time. Tendinitis, sprains, strains, muscle tears, healing which normally would require months of rehabilitation, basically cessation of any activity like stopping working out. And the administration of BPC-157 has shown to heal certain issues in weeks or even days. This can be contributed to reduced inflammation, angiogenesis, increased GH receptivity, increased collagen, and additional oxygen and blood flow to the injury area. Reduced pain from inflammation is in effect systemically, so it goes throughout the whole body to reduce inflammation. Organ rejuvenation, like detoxifying the liver from excess NSAIDs, shown to improve end-stage kidney failure by reducing inflammation, increasing endothelial lining, elasticity, and increasing kidney function. The same effect can also lower blood pressure. So this is pretty astounding. BPC-157 also increases nitric oxide production. It decreases wound healing time, been reported as well through angiogenesis properties, again, increasing blood flow and oxygen to the injured area, decreasing inflammation, and repair of tendons and ligaments from the increased collagen synthesis. This is again from the increased GH receptivity, which then creates fibroblasts within the tendon and ligaments, creating collagen, and then the repair of that. This usually takes months, if not several months into years, to fix and repair a ligament tear or a tendon tear. Sometimes they have to be surgically repaired. But when it comes to a sprain or strain or tendinitis, it can take months and months and months, and you got to stop doing what you're doing. And it's impossible. If you're going to continue to work out, you're just going to make it more aggravated. BPC has also improved mood and memory. Some evidence has shown BPC-157 to be neuroprotective against free radical damage in the brain. It can reverse that damage, improving memory and cognitive ability, preserves brain function and neural communication after injury or exposure to toxic substances. Mice trials proved upregulation of GH receptor expression, increased activation of muscle growth, and increased receptor activation in muscle, tendons, ligaments, bones, and skin. Restores the serotonergic transport system, which may improve mood, anxiety, depression. Because of all of this, it contains antidepressants. Improves the immune system and can reverse mitochondrial damage. This stuff is incredible. Again, more on the miracle side as opposed to the hype side. But this is all data from mice trials and rat studies. My experience, I've taken it probably, 4 or 5 different times. I've had elbow tendonitis on both arms several times. Typically, it's like 3 to 6 months of pain. Drives me crazy because you can't hold on to anything because you hold on real tight and you get that real pain here, right on the tip of the elbow, or right here, right on the inside of your elbow, right there. I've had it on both sides, both left and right, and both lateral and medial side of my elbow. I've had a bicep strain when I was trying to move a crate full of tiles. I didn't do a 3rd-degree tear, thank God, but I really sprained my bicep tendon one time. I've had chronic right side shoulder issues, and I've reduced some vascular injuries to the back of my hand. So each situation that I had, I injected 250 micrograms of BPC-157 twice a day, once in the morning and once at night. I used one bottle, so it was about 10 days worth of medicine. And within a couple of days, the pain was gone. Sometimes a day. I thought that was anecdotal. I'm like, no way. I can't even feel it right now, but I'll just keep going. Seriously, within a couple of days, the pain was gone. And within 2 weeks, or that 10-day period, I forgot I even had tendonitis in my elbows. The shoulder took about 2 weeks to go away. My bicep, the pain went away. And the vascularity in the back of my hand has rejuvenated to the point where it was before the injury. Incredible outcome. For me personally, unbelievable. Because these are things that were lagging, and I had some time off from the gym. When I went back to the gym, I immediately developed tendonitis in my elbow from squeezing too hard. It's just something I do. And I had forgot about BPC-157, so I was dealing with this for like 6 months. I was trying to use straps and wraps and do different hand positions, and it just wouldn't go away at all. 6 months I was dealing with this. And then 2 days with BPC-157, it's like I don't even have it. And it was getting progressively worse. It's just my story, but it worked. I've had also many other people that I've talked to that have used it for different issues, shoulder issues. Some guy used it for his knee. And they've all had the same outcome. They couldn't believe it. They thought it was fake at first. They thought it was placebo. And then within 2 weeks, the pain was gone and they're back to 100% back in the gym, enjoying workouts as though they were never injured. So dosing protocols. Typically, I've seen recommendations of about 250 micrograms per day, once a day. However, I've also seen some crazy new recommendations. I don't know if they're crazy or not. Up to 5 milligrams first bolus dose. So the first time you take 5 milligrams, one full container, and then you do 250 micrograms a day for another few weeks. I don't know. That seems like a little excessive. It's also expensive too, because it's not expensive. You can find it from $30 to $50 to $60 a bottle. So if you're going to take a bunch of this stuff, it's not going to be cheap. Especially for me, 250 micrograms twice a day worked. Why take more? There's no reported lethal dose. You can't toxify your system. It's be like, oh, you eat too much steak. You can't really do that, right? It's not really possible. Because it is a protein, it's already in our body, so you can't, from what I've seen, what I've found, there's no reported lethal dose. You can't become toxic or poison yourself from taking too much. That'd be like poisoning yourself with too much steak. Chicken. So animal studies up to 10 micrograms per kiloliter of body weight, which would be an incredible amount if that was a person, have been reported without any toxicity. So it seems very safe. So typically you're going to do a sub-Q injection as close to the injury as possible. So for me, this elbow, I injected it right about here. Just grab the skin, and I poked it right in the skin right there. If on this side, it was on the inside, obviously. And for my shoulder, I just put it in my shoulder. So it would just go throughout my shoulder. That's typically the experience and the recommendation for orthopedic issues. If you have gut issues, you can put it in your belly, anywhere around your belly button, whatever. It's going to go systemic. I have zero experience with the oral or nasal products. I just haven't used them. I hear they work perfect because they're going to go into your nasal capacity, go into the bloodstream, go systemic. So you can use it that way. It's a lot more expensive. The injectable versions are, like I said, 30, 50, 60, 70 bucks, where the nasal spray is well over 100 on Amazon. Or the orals is crazy money. It's well over 100 bucks. Whereas if you know where you're going to put it, you know where your issue is, and you just inject it in that issue. Again, if you're afraid of needles and that sort of thing, maybe the oral route is better. It's worth it, no doubt. If you need BPC-157, it's worth trying to find it and taking it for whatever issue you have. In terms of the gut and stomach issues for inflammation, obviously that's probably be the best route to take it orally or through your nasal capacity. So it's going to go into your esophagus and get down into the bloodstream and go through your gut. So that's probably the better mechanism as opposed to an orthopedic issue. You put it in your elbow. So in reference to the dosing protocol, I wanted to get into something else. When you buy BPC-157, again, this research chemical, this is what it looks like. It's in the powder, constituted form. You need to buy bacteriostatic water. Why? Bacteriostatic water has been treated with benzyl alcohol. You can see it right on the side of this label, benzyl alcohol. This kills all bacteria within the water. Let's say you used water from the tap or something. There is micro amounts of bacteria in that water that would degrade the protein in this over a long period of time, because you're going to store this for possibly a couple weeks. So it has to last, and the stability of the protein will only last unless there's no bacteria in the bottle or in the water, because the bacteria eats away the protein. So when you take it, then it doesn't do anything, so it's no good. So that's something to really make sure of. You can't just put regular water in it. You have to use bacteriostatic water because of that bacteria. Second, when you reconstitute it, take a little insulin pen, draw up the water. I'm not going to do it because it would waste this, but you just, take this off, pull up the water out of this, and then when you put it in here, make sure you squirt it. When you put it in, squirt it to the side. So that way the water is hitting the side of the glass, not directly into the powder. This is a delicate protein. You don't want to shake it. You don't want to, really vigorously shake it to get it to emulsify. Put the water in. You can roll it. Just be gentle with it. You can kind of swirl it around, but don't sit there and shake it up, because that may break the protein and it makes it less potent. So again, those two things are very important. Bacteriostatic water, and don't shake the bottle. And once you're done, you take a little bit out, put it in the fridge. The way I do it, this is a 5 milligram vial. I put 2 milliliters of water in this, and then it's quick for me to figure out, okay, so if I need 500 micrograms, that's 0.2 on this, syringe. So basically half is 2.5 milligrams, and then half of that is 1.75, and then half of that. So you just work it down. So it's a tiny little injection. Just do the math, figure out how much water you want in it, and that will give you your concentration, and then that will tell you how much you need to daily inject in the morning and at night. Typically for me, it's about 0.2 to 0.3 in the morning, 0.2, 0.3 at night. And that's how I mix it up. Pretty easy. Just something you want to make sure of. Don't mix it with regular water. These are like $10 on Amazon. That's how to reconstitute BPC-157 in most any type of compound that comes in a powder solution like this. Growth hormone and all kinds of peptides come in a constituted vial like this, so you'll have to get used to that. It's pretty easy. And in terms of the syringe that you're going to use, this is how small it is. It's tiny. This is like a 31 gauge, 1/4 inch or 1/2 inch, because you're just breaking the skin, literally just going under the skin. You don't feel it at all. It's not even close to a bee sting. It's a lot of times you don't feel it. Expectations: you should feel reduction in pain within a couple of days. That's what I've seen. That's what most of my friends have seen. You should feel an increased mobility and ability to move within a week if you've got a joint issue. I typically expect the injury or chronic issue to be pain-free within 2 weeks. I've had to repeat the protocol twice when the tendonitis returned, because I was an idiot and just worked out too quickly, too fast. But the injury should be 100% within a few weeks. So if you take the protocol for 2 weeks, just lay low for a couple weeks. You're not stopping working out. You're just not going like an animal like I do. And give it time to heal, and it will literally go away. I don't have tendonitis anymore, and I didn't do any rehabilitation. I didn't get any massage. I didn't do any Graston bar work or that crazy and painful, active release technology. I did nothing other than take BPC-157, and it went away within a day. Pain-wise. Within a couple weeks, it was gone. So give it time to heal, and it should work for you. Again, it's research chemical only, so you can't consume it, but you can buy it. Wink, wink. Because Big Brother's watching us, because they're really concerned with our health. But go smoke those cigarettes and drink that alcohol, because that's fine. That's cool. It's good. Just don't take something that will heal you in a couple of days, because they want to make sure you'll go to the doctor and cut you open. Anyways. So that's my story on BPC-157. I think the next one I'm going to do is Foxo4 Dry, which is a nootropic. It's a anti-aging miracle drug. I'm going to save the rest for that video, but we're going to continue this vampire series on how do we get younger, faster, stronger, heal better, and feel better, be smarter, basically become a vampire without sucking any blood. Anyways, hopefully you liked the video. Please like, subscribe, comment below. My name is Todd Derry. This is TD's Fat to Fit. Until next time, talk to you soon.